Hello, my name is Dr. Emran Ghaffar Khan. I'm an endocrinologist. I'm a specialist in hormones. I have recently joined King's College London Hospital, Dubai. I've been working here for about 3 weeks now. I did my training in United Kingdom and have worked there for the last 25 years. I'm really enjoying my stay here, and I'm seeing lots of patients here with this particular specialty. People ask me what an endocrinologist is, and I have to explain to them this is the specialty which deals with hormones which control all the body different functions. A specialist is somebody who has more experience in that particular field and is kept up to date and has facilities to be able to investigate and diagnose in this particular area. Doctors in general have experience in hormones, but they do not have the width of experience which a specialist in this field has. This field includes a lot of conditions. Particularly high on the list is diabetes. Diabetes itself is divided mainly in two groups, type 2 and type 1, though there are many other groups which I will not talk about today. The more common one is type 2 diabetes, which in particular is very common in this part of the world. However, it's a growing condition all over the world. The reasons people tend to ask is generally environmental and our lifestyles and how we exercise and eat. And in this part of the world in particular, there is a lot of temptation to be able to have a better life with more eating, less exercise, and so on. Type 2 diabetes is mostly dealt with medications such as tablets, but sometimes we have to use injectable treatment, and there are lots of new treatments available now which we are at hand. Well, it's important to control diabetes because it's a silent killer, as they call it. It can affect all parts of the body. Hypertension is a common condition which is generally treated by non-specialists. However, it is important to remember that a specialist endocrinologist sees somebody who has hypertension. This is because very often secondary causes of hypertension are due to hormonal conditions causing high blood pressure, which may be due to an adrenal gland which is sitting on top of the kidneys producing hormones such as adrenaline or aldosterone. These hormones cause high blood pressure, and if that hormone is corrected, then the blood pressure will settle down. It could either be treated with medication or by surgery. I also look after patients with obesity. It is my special interest. Obesity is very common in this part of the world, as it's a growing problem all over the world. A lot of it is due to the environment and our lifestyle, but has a lot to do with our genetics also. There are different modalities and ways to deal with obesity, which include dietary control, medications which can help with this, and bariatric surgery, which we have facilities here at King's College London, Dubai Hills. I also look after Polycystic ovary syndrome, which is also known as Pcos. This is a very common condition in younger women and women of older age also. They present with irregular periods, problems with getting fertility, and also may present with increased hair growth on the face. These situations cause a lot of distress to patients and need to be dealt with in a proper specialist, by a proper specialist, and given appropriate medications and help so that their distressing symptoms can be corrected. I also look after thyroid. Thyroid is a very common condition which can either present with overactivity or underactivity. When the thyroid gland is overactive, which is a gland which sits in the neck, this causes a condition called hyperparathyroidism. There are different ways to manage it. The patients come with symptoms of feeling hot and sweaty, feeling irritable, losing weight, and getting palpitations. Whereas underactivity, which is hypothyroidism, is caused by an underactive thyroid gland, and this requires lifelong treatment with tablets such as thyroxine. Another gland which sits on top of the thyroid gland is called the parathyroid gland and is responsible for calcium control. This is commonly found in regular routine evaluation and blood tests, as the patients may be unaware of this condition. A lot of damage to the bones and can cause harm by giving patients kidney stones, and it can cause heart problems also. That is irregularity of the heart. The calcium is controlled by these parathyroid glands and needs to be controlled either with medications or surgery, but the mainstay of treatment is usually surgery in these situations. Comfortable to discuss is erectile dysfunction, which is fairly common in diabetics and other patients who do not have diabetes. However, it's a hidden problem which people do not like to discuss. There's a lot of hormone conditions which can cause such problems and need to be investigated and corrected, and help given to remove the distressing symptoms of erectile dysfunction, which can affect the patient themselves and their family in general.